Hey y'all, I'm taking this little boy, Ozzy, to the MD Anderson for dogs. Anyway, it's to a specialty clinic in Houston. So Ozzy is my alpha Cane Corso dog. If you're new to the channel, Ozzy. Hi, Papa. Come on, Oz. Come on, Oz. I got some food for him for whenever we're done with the appointment because he has to be fasting. It's about, what is it, 7 a.m. right now? And he's got to be fasting for the appointment. Just a minute, Vito. Oh, goodness. Oh, and Vito is my Cane Corso puppy, if you're new. He is not happy. Just a minute, Vito. He is not happy. Well, just a minute. I'll be back. Hi, hey, baby girl. Vito, stay there, baby. Okay, Oz, come on. Come on, Oz. Come on, we have to go. We have to go. Come on, you ready? You ready? Ozzy loves going on a car ride. Okay, Oz. Yes. So I'm just filling the tank up with gas, and I got hopefully make it to the appointment on time because I got to drive all the way to Houston, which is almost 4 hours away. But Houston traffic is kind of unpredictable. Hi, baby boy. He does that when he wants me to continue petting him. Hi, Papa. Let's go. Come on. Good boy. All right, we've arrived 10 minutes early. Yeah. Ozzy, where are we, Papa? You ready? Hi, baby boy. You were sleeping. So, yeah, it's about a 4-hour drive. And this place is huge, y'all. Let me just get some parking. Get in there. Well, y'all, I had to drop Ozzy off. Well, they have Ozzy. The vet has already seen Ozzy, and he said he felt the lymph node area, and he doesn't think that they're enlarged. He even got the oncologist to come kind of look at them as well and feel them, and he said, no, they don't feel like they're enlarged, which is a great thing. The other thing it could be is some salivary gland enlargement. He has a low suspicion, but he said what could be what happened earlier in the year. I don't know if y'all remember, but Ozzy had some drooling on one side of his mouth, and it may be that he has this kind of transient like a cyst or inflammation of the salivary gland. That's possible. But anyway, I drove 4 hours out here, so he said, you know, what we could do is I could sedate Ozzy and just take an aspirate out of the lymph nodes and that little cyst-like thing on his neck. So I might do that. Okay. Just waiting for the vet to come in. Ozzy. It's about almost 6 p.m. and he's been here almost an entire work day. Hi, Papa. Okay, baby. They said he was very good. He's a good boy, honey. So they sedated him and took some aspirates of his lymph node area and that little nodule that on his chest. Baby boy. So we'll see what the vet says. He's coming in to give me a summary. Ozzy, are you thirsty? Okay, baby boy. Might be thirsty. I'm not sure if he's had any water all day or not. Okay, darling. Good boy, Oz. Good boy. Okay, y'all. Well, we're back. There's Vito. His ears are looking good. There's Ozzy. Hi, Papa. But the morning glory kind of took over. But aren't they pretty? It is morning and they are in their glory. Yes. He's got glue on his ears from the tapes that the vet put on. Okay, baby, come. Hi, darling. Come on. Squishy. Okay. Vito. Hey, Gia got it. Gia got it. Get it, Vito. Get it, Vito. Get it, Vito. Vito. They're playing keep away. Hey, baby boy. Yeah, so, hi, baby. Oh, hey, baby boy. Yeah, so you can see from the vet where they shaved this area to do the aspirations, the needle aspirates of his lymph nodes. Oh, wait, look at that structure. Goodness gracious, he's got a beautiful structure. And so he's doing very well. And I don't have results yet because they send that sample to Colorado to a special lab, special vet lab that analyzes that sample to look for lymphoma. Very low suspicion for lymphoma because the vet didn't really think they were very much enlarged, if at all. And that it could have been the swelling that he had previously could have just been from a salivary gland cyst or inflammation of the salivary gland, perhaps, because the salivary gland's in that area as well, kind of the submandibular area. So yeah, there's another little part where they shaved both sides there, and he did very well. They didn't have to completely sedate him like with general anesthesia. It was just very light sedation. But all that, y'all, cost $1,500, that vet visit, because it's a very expensive clinic, which I didn't know. I didn't know that just to walk in the door with an appointment costs $200. Yeah, so the visit is $200, but that doesn't include the initial evaluation from the vet, which is $300. So right off the bat, before you get anything, even if you don't get anything done, just for having an appointment there costs $500, which sounds completely ridiculous. Hi, baby boy. And but you know, I had to pay it because they didn't tell me that up front, of course, but they had me sign papers, like a bunch of papers, like, hey, this is just to say that we're gonna be seeing your dog, blah blah blah. And so I'm sure it's in the fine print. So that's how they get you. But so it was kind of funny because
while I was waiting. Well, first of all, it's a little bit different than the vets that I'm used to because, well, it's a state-of-the-art facility. It's huge. Like I said, it's like MD Anderson in Houston. It's just humongous, very, very nice facility. But they, when it's your time, the vet tech takes you back to a room, which is what I'm used to. The part that I'm not used to is after the vet tech gets your information, she takes the dog back to the vet, and the vet examines the dog without the owner being present. And I was like, well, can I just be present? Because I'd like to show the vet a few things, what I'm concerned about, like this little thing that I think is a skin tag and that little nodule. And, you know, I'd like to talk to the vet in front of the dog, and also to kind of calm my dog. You know, especially with a Cane Corso, I'd rather be present with my Cane Corso when he's meeting the vet for the first time. But she said, no, that's just the way that we do it. We don't do it like that. The vet likes to examine the dog without the owner, and then we'll bring the dog back to you, and then the vet will come in to talk to you later. So anyway, it was kind of strange, but that's how they do it. So, but it was a very nice vet, and he said Ozzy did fine with him. I ended up being there for like the entire day because he told me, you know, if he's going to do that procedure, the needle aspirate of the lymph nodes and all that, then he said it's going to be several hours because he has 2 procedures in front of me that he has to do for two different other dogs, and he's not going to get to Ozzy until later in the afternoon. And at this point it was like 11:30 p.m. or sorry, 11:30 a.m. And so I ended up just having to wait in Houston. I actually drove to Galveston just to kill some time because it's only an hour away. So So yeah, they had Ozzy for a good 5 hours back there. And when I picked Ozzy up, they were like, yeah, he did very well. We didn't have any issues with him. So that was good. Everybody was just saying how handsome he is and how they just love him. I mean, he's a good boy. But anyway, more to follow. I'll let y'all know when I get the results back. They also did a complete blood test, which was relatively normal. There were only 2 values in his complete blood test that were a little bit elevated, which was his globulins and his protein level, total protein. And the significance of that is not clear at this point. It's more of like, let's retest it later and see if it changes, see if it increases more, or if it stabilizes. And it could mean, it's very non-specific. It could mean anything. It could be due to just a transient infection, or, you know, I mean, he was fasting as they suggested before I got the blood test for him. Vito! Vito! Because I was going to say, it could be, sometimes it's due to if they ate. Like if he ate a big juicy steak and they took his blood. But that didn't happen. But anyway, the vet's not too concerned about that. His calcium levels were apparently normal, so calcium can be elevated in some tumors. Hi, Papa. Hi, baby boy. And so he did make sure to get the chemistries there, and that looked normal, so that's a good thing. So far, he saw normal. Kind of makes me a little upset, though, because I wasn't present when the vet was evaluating him. I didn't get an answer on what this thing is, which I think is probably a skin tag. But I did when the vet tech was telling me, no, you're not allowed to be back there when the vet's evaluating him, but you can tell me anything that you want to talk about and I'll relay it to the vet. Well, I did mention that little skin tag looking thing. And then the vet never mentioned it to me when he came back in the room. And then I forgot to ask him again because, I had already told the vet tech about it and everything, but $1,500 and I didn't get like a complete answer on that. So hopefully the vet tech did relay that to him and he looked at it and wasn't concerned, but just really not happy about it. A lot of things about that clinic. First and foremost is the egregious price tag for what I got. I don't think that was worth $1,500, but the vet, they're very specialized there, so yes, they should be well compensated for their expertise. So maybe that's part of it, but it was definitely a sticker shock. Oh, this is what I was gonna tell you. Come on, Vito. This was so funny, y'all. While I was waiting alone in the office while the vet tech took Ozzy back to the vet, and I was just sitting there in the office. Well, the office across from me that had a patient in it, the lady was yelling so loud about the price, and I think she was yelling at her vet that had her vet clinic, or maybe not her vet, but she had called her vet clinic. And because, see, this place that I went to, it's a referral clinic. So to get an appointment there, you have to be referred by your vet. So apparently her vet referred her there to that clinic for an ultrasound and some things, diagnostic tests for her animal. And so she was yelling at the clinic saying, you told me this was just going to be a couple $100 and for an ultrasound and blah, blah, blah. And you did not tell me that I'm going to pay $200 just to walk into the door without even being seen is $200. And then $300 just to be seen, not including the ultrasound. And then this is $1,000 bill. I'm not going to pay this. I wasn't told up front how much this was going to be. And of course they had already done all the procedures on the dog that she had there. So they had given her the bill. she was livid. Lucia. And then I had, my door was open in my office and hers was closed, but I would see a couple of the vet techs come by outside of her door, and they were like, all right, well, she's not done yelling yet, so we'll wait a minute before we go in there. Man, she yelled like that for like a complete, at least 10 minutes, probably 15. And she was, she was giving them a piece of her mind. But I was like, I was a little prepared of what my bill was going to be when I was hearing her yell about that. I was getting prepared, like, okay, so now I know I'm not walking out of here without paying at least $1,000. So when they brought me the bill, I was a little bit prepared. But, and they also did give me a quote, before I paid it. So, but I could have elected not to have that sample of the lymph node done, because that would have shaved off probably $800 off the bill. But to me, I was thinking at the time, I drove 4 hours out here, and I'm not walking out of this clinic today without paying $500, because just for sitting in this office and talking to the vet is $500. So in my mind, I was like, let me just get peace of mind since I'm here anyway, and I'll shell out another $500 to get an answer and a sampling of that nodule on his chest and the lymph nodes, which the lymph nodes at the time he was not concerned, but there are some kind of more indolent, kind of smoldering, low-grade lymphomas, which are very rare in dogs, like a B-cell lymphoma, more common in humans, but the lymph node isn't extremely enlarged. It's just a little bit enlarged, and it's a very low-grade lymphoma. But you know, I figured, since we're here, let's just get some answers and peace of mind. And it's a very low-risk procedure. They stick a tiny, tiny needle in the lymph node and aspirate out some of the contents of the lymph node, and that's it. So he doesn't even. Actually, you can see a little bit where they were poking at it, but he had to get, I think, at least eight passes of the needle, because if it is abnormal, they send it to a machine called flow cytometry. The machine will then, like if it looks abnormal on the slide to that vet in Colorado, he'll put an additional part of the sample on a machine called flow cytometry, and that machine will say if those lymphocytes are abnormal or not, and what kind. It'll say what kind of lymphoma it is, because there's several types of lymphoma. There's B-cell lymphoma, there's T-cell lymphoma, and then there's variants within that. There's a histiocytic lymphoma. So that machine analysis is only done if the vet that looks at it, the veterinary pathologist that looks at it on the slide, is like, oh yeah, these do look a little abnormal, let's put it on the machine, the flow cytometry machine, for analysis. But yeah, like the vet was saying, those kind of smoldering low-grade B-cell lymphomas are very rare. It's more common for a dog to get a T-cell lymphoma, is what he was saying. Which in humans, it's kind of the opposite, I think. B-cell lymphomas are more common than T-cell lymphomas. And then there's leukemia, which is a lymphoma that's in the bloodstream. So a lymphoma in and of itself can be just localized to the lymph nodes and not yet a leukemia. Once those lymphocytes are like all in the bloodstream, it's called a leukemia. So I was worried more about like a lymphoma developing, because if you catch it early and it's restricted to the lymph nodes, you can potentially have those lymph nodes excised and take it out, and before it really spreads into the bloodstream, and it's a better prognosis. So, but you know, I'm rambling. It's like I said, it's just very low suspicion, which it was a relief. I would gladly pay for an oncologist to be able to look at his lymph nodes. Now, the vet that saw him was an internal medicine vet, but he did tell me that he got the oncologist. That's the nice thing about that center, and I think that's what you pay for, is when you go to that center, they have every kind of specialist you could ever want right there on site. And so the value of that is that the internal medicine vet was like, I just walked down the hall and I grabbed the oncologist to also feel those lymph nodes and tell me what he thinks. So, or he or she thinks, I don't know who it was. So that was very reassuring that the oncologist actually felt those lymph nodes, because oncologists, they deal with lymphoma every day. They're very well versed in what a lymph node feels like, you know, when there's even a low-grade lymphoma. So he got the opinion of the oncologist, and the oncologist was not worried at all. So that was extremely reassuring. And like I said, I would gladly pay extra money to have an oncologist look at it, and to be able to have the resources, of them to take a sample and get it triaged appropriately and everything. So, and like for me, it was how some people, they say there's a convenience fee and all that. This was a peace of mind fee that I was paying, because, like I said, you have the specialists at your fingertips in that clinic, all the specialists. And my vet is very good. My local vet, I almost feel a little embarrassed, because basically what I was told at the specialty clinic in Houston was the same thing. My vet, she had low suspicion as well, but she understands. She probably gets patients like me all the time, or owners like me all the time, where they're just paranoid, and she's like, all right, if you want a consult, I'll give you a consult. But and the thing is, she could have done the needle aspirate, but I don't think they're really set up as well to do that, which is another reason she's like, yeah, it's probably, they do those more often at the specialty clinic and all that. She could have done it and sent it out, though. So, like I said, my vet's very good. She's got great hours, and I'm very happy with my local vet as well. So, and the vet my local vet is not one that does, like, they'll try and price gouge you and get you to do a bunch of procedures that are unnecessary. So I really trust her opinion and value her opinion as well. But I'm just, after hearing about people's dogs with lymphoma, I am admittedly just overly cautious, maybe paranoid. So it really wasn't necessary what I did, taking him to Houston. But like I said, I'm paying for the peace of mind. So anyway, I'll stop rambling here. I gotta get to work, actually. And Vito's ears are looking much better, y'all. They're starting to stand up more and more every day. So thanks for tuning in. Don't forget to subscribe, and we'll see you on the next one.